Hello everyone. Today I have started a video lecture series of pharmacology. This is my first presentation, and on daily basis I will upload uh, these topics of pharmacology, and I will teach you from the Lippincott 6th edition and the CPR book. Okay, so I have prepared this presentation from the Lippincott 6th edition book of pharmacology and CPR. So let's start. Tetracyclines. The classification of tetracyclines is that it includes drugs like demeclocycline, doxycycline, minocycline, tetracycline, and oxytetracycline. These are the drugs which are present in this class. Now, what is the mechanism of action of tetracyclines? So these are basically protein synthesis inhibitors and bacteriostatic drugs. Okay, and these drugs enter susceptible organism via passive diffusion and also by an energy dependent transport protein mechanism. Okay, so we can say that these are protein synthesis inhibitor, and these drugs bind reversibly to the 30S subunit of the bacterial ribosome and prevents binding of the transfer RNA to the messenger RNA ribosome complex, thereby inhibiting bacterial protein synthesis. Okay, so these are the group of antibiotics which are protein synthesis inhibitors. So now coming towards the pharmacokinetics of tetracyclines. So dairy products, magnesium and aluminum antacids are iron supplements. This decreases the absorption of tetracycline due to the formation of non-absorbable chelates. Okay, it forms the chelates which are non-absorbable. So because of this, it decreases the absorption of the tetracyclines. Uh, they bind to tissues undergoing calcification, e.g., for example, teeth and bones are tumors that have a high calcium content. Okay, and only minocycline and doxycycline achieve therapeutic levels in the cerebrospinal fluid. These two drugs, it also crosses the BBB, a blood-brain barrier. All tetracyclines cross the placental barrier and concentrate in fetal bones and dentition. Okay, tetracycline and doxycycline are not hepatically metabolized. Tetracycline is primarily eliminated unchanged in the urine, whereas minocycline undergoes hepatic metabolism and is eliminated to a lesser extent via the kidney. Okay, so in renally compromised patients, doxycycline is preferred as it is primarily eliminated via the bile into the feces. Okay, so these are something about the pharmacokinetics of tetracyclines. Now, coming towards the antibacterial spectrum of tetracyclines, these drugs are effective against gram-positive and gram-negative bacteria, protozoa, spirochetes, mycobacteria, and atypical species. These are some of the species against which these drugs are effective. Now, what are the therapeutic uses of tetracyclines? So, the first use is that these drugs are the drug of choice in rickettsial infections. Okay, rickettsia is a genus of non-motile gram-negative, non-spore forming highly pleomorphic bacteria that are transmitted to humans by the bite of infected ticks and mites and by the feces of infected lice and fleas. Okay, they enter via the skin and spread through the bloodstream to infect vascular endothelium in the skin, brain, lungs, heart, kidneys, liver, gastrointestinal tract, and other organs. Okay, so these drugs are the first line drugs in the treatment of rickettsial infections. Now, the other uses is like that these drugs are effective in mycoplasmal infections, chlamydial infections, amoebiasis, cholera, brucellosis, tularemia. Okay, So these are some of the therapeutic uses of these drugs. Doxycycline is highly effective in traveler's diarrhea. Okay. Demeclocycline is used in syndrome of inappropriate antidiuretic hormone, and these drugs are also effective in the treatment of Lyme disease. And moreover, doxycycline and minocycline, we can use these two drugs in the treatment of refractory acne vulgaris. These two drugs are very effective in acne. Now coming towards the doses of the tetracycline, that how we will use these drugs. So demeclocycline, these drugs, these are eliminated via renal route, and the half-life is 10 to 17 hours orally, and 300 milligram to 1 gram per day is the daily dose. Similarly, doxycycline dose is 100 to 200 milligram every 12 hours. The dose of the minocycline is 100 to 200 milligram every 2 hours. And similarly, the oxytetracycline dose is 250 milligram to 500 milligram every 6 hours. Okay. And the tetracycline dose is 1 to 2 gram per day. So these are the doses of the tetracyclines. Now, what are the adverse effects of the tetracyclines? So it causes GI distress, gastrointestinal distress, hypersensitivity reaction, phototoxic reactions, hepatotoxicity, permanent tooth discoloration. Okay, these are the very famous adverse effects of the tetracyclines. Retard bone growth in infants. Outdated and degraded tetracyclines may cause renal tubular dysfunction, possibly renal failure. Okay, so aminocycline can cause vestibular toxicity. So these are the adverse effects of the tetracyclines. Now, what are the drug interactions of the tetracyclines? So the first one is that antacids, dairy products, iron supplements, plus laxatives, these decreases the absorption of these drugs. Okay, uh, it forms the non-absorbable complexes with the tetracyclines, and it decreases the absorption of these drugs, but except doxycycline. Okay, antacids, dairy products, it does not decreases the absorption of the tetracycline. Okay, methoxyfluorine, it exacerbates the nephrotoxic effect of the tetracyclines. Okay, and phenytoin and barbiturates, it decreases the effects of these drugs. Okay, so these are very famous drug interactions. Okay, the first one is that antacids, dairy products, iron supplements, laxatives, these will decreases the absorption of these drugs, but except doxycycline. And methoxyfluorine, it exacerbates the nephrotoxic effect of the tetracyclines. And these phenytoin and barbiturates, it decreases the effects of these drugs. Now, coming towards the resistance, how resistance develop to these drugs. Okay, so the first mechanism is that activation of the efflux pump. Okay, that expels drug out of the cells, thus preventing intracellular accumulation. This is the first mechanism of resistance, that efflux pump will be activated, and that efflux pump will activated, it will expels a drug out of the cell. Okay, and the second one is the enzymatic inactivation of the drug and production of bacterial proteins that prevent tetracyclines from binding to the ribosomes. This is the second mechanism. And the third mechanism is resistance to one tetracycline does not confirm universal resistance to all tetracyclines. Okay, so please remember this, that resistance to one tetracycline, it doesn't mean that it is resistant to all the tetracycline. Okay, so now coming towards the contraindications of the tetracyclines. Please remember that the tetracycline should not be used in pregnant or breastfeeding women or in children less than 8 years of age. Okay, so In this presentation, I have discussed the uses, the classification. This is the summary that I have discussed the classification of the tetracyclines, and then I have discussed the mechanism of action of tetracyclines, that these are protein synthesis inhibitor drugs, and it binds reversibly to the 30S subunit of the bacterial ribosome and inhibits the protein synthesis. Okay, and the pharmacokinetics we have discussed, and the antibacterial spectrum we have discussed. Okay, that these drugs are effective against gram-positive, gram-negative bacteria, protozoa, spirochetes, mycobacteria, and atypical species. Okay, and then we have discussed the therapeutic uses, that these drugs are effective in rickettsia, mycoplasmal infection, chlamydal infection, amoebiasis, cholera, brucellosis, tularemia. Doxycycline is highly effective in traveler diarrhea. Doxycycline and minocycline is very effective in refractory acne vulgaris. Dimeclocycline is used in the syndrome of inappropriate antidiuretic hormone. These drugs are also effective in Lyme disease. And then we have discussed the doses of the tetracyclines. Okay, and the adverse effects of the tetracycline, which are GI distress, hypersensitivity, phototoxic reactions. Phototoxic reactions are very common when we are using the tetracyclines. Okay, specifically, we should be careful about the tetracycline use when we are using these drugs in the treatment of the acne vulgaris. Okay, so in the permanent tooth discoloration and outdated and degraded tetracyclines may cause renal tubular dysfunction and possibly renal failure. So you should be careful about and you should check the expiry of these medicines. Okay, so then we have discussed some drug interactions. So please remember that these drugs, the absorption of these drugs decreases when someone use it with antacid dairy products, iron supplements, or laxatives. But this rule is not applied on the doxycycline, sorry. And methoxyfluorine, it exacerbates the nephrotoxic effect of the tetracyclines. Phenytoin and barbiturates are the drugs which decreases the effects of these drugs. So please remember the drug interactions of these drugs. Then we have discussed the resistance mechanism. So please remember that efflux pump mechanism is very common. Efflux pump activated and it expels the drug out of the cell. Okay, and prevent the intracellular accumulation. The second mechanism is enzymatic inactivation of the drug. Okay, the drug is inactivated with the help of enzymes. Okay, and but please remember that resistance to one tetracycline does not confer universal resistance to all tetracyclines. Okay, and the contraindications that please remember, these drugs should not be used in pregnant women or breastfeeding women or in children less than 8 years of old. Okay, so these are some of the topics. Okay, related to the tetracyclines. I have prepared this presentation from the Lippincott Pharmacology book, 6th edition, and Comprehensive Pharmacy Review for Neplex 8th edition. Thank you so much. And if you are new to my channel, you can please subscribe to this channel, because from now I will daily upload the pharmacology lectures. Okay, and I will prepare this presentation from the Lippincott Pharmacology and CPR, which will help you in your academic exams and your registration exams around the world. Okay, so thank you so much.